There's 3 different types of way you can use Ultherapy. It can be either as a preventative, as a treatment, an aggressive treatment, or as maintenance. Preventative treatment would be for those patients who are either between those 20s and 30s that don't really have a noticeable issue yet, so they can start using Ultherapy to boost your collagen. As we all know, the best way to boost our collagen is by mechanically causing a micro injury, whether it's through Ultherapy or microneedling. But when you cause that micro injury to your skin, you're telling your skin to produce this collagen because there's somewhere that needs to be healed and strengthened. So that collagen will be produced at that area, giving you just a plumpier skin, give you a better glow, just making your skin stronger. Also, for some patients, it can help to kind of lift your brows and open your eyes a little bit. And that doesn't really have to do with an age, more as a concern. Then a more aggressive treatment is a patient who is showing signs of aging. So it could be either jowling or like heavier folds, some light banding in the neck, heavier brows, hooding on the eyelids. Ultherapy can definitely help to either elevate the brows, kind of lift off the hooding from the eyelids a little bit, tighten the muscles of the neck, the jawline, and the cheeks, just making the face look a lot more youthful. And then as a maintenance treatment, Ultherapy can be used after a surgical procedure. So if you've had a facelift, you can do Ultherapy a year, 2 years later, and that will help to maintain your results. Just keep everything nice and tightened and lifted. After a certain age, we all know that collagen just becomes a lot slower. So at that point, when you cause those micro injuries with something like Ultherapy, it just kind of rejuvenates your face. The best thing about Ultherapy is that it could be customized for your specific need. You don't have to do your full face and your neck. You can just zone into those little areas that bother you. So for some patients, their upper face is what draws their attention. So you can just treat your eyebrows, your crow's feet area, and your lower eyelids. You can just treat your jawline and your neck, or you can just treat your cheeks and your jawline. I always like to combine jawline with either cheek or neck just because it gives a much more complete result, but it's completely customizable. And if you do want to have a consultation and kind of see what Ultherapy can do for you, just give us a call.